Okay, good afternoon, everyone. Thank you very much for attending this very lovely cold afternoon, but at least the sun is shining, so that should make us smile a little bit. So good to see you all, and this is the first meeting of 2023. The last time I saw some of you was last year. That was a very long time ago. So welcome everyone, and thank you for joining us. My name is Abigail Marshall Katung. I'm the elected member representing Little London Woodhouse and the City Centre, and also the chair for Scrutiny Board for Adults, Health and Active Lifestyle. So this meeting is being webcast on the council's website so that any interested members of the public or other stakeholders who are unable to observe in person can still observe remotely. The meeting recording will also be available on the council's website after today's meeting. So I will now invite board members to introduce themselves, and I would call you out in alphabetical order. Could I also kindly remind each and every one of you that after you have finished speaking, please kindly mute your microphones, okay? So I will start with Councillor Anderson.
Good afternoon, everybody. I'm Councillor Caroline Anderson. I represent Adlon Wharfdale Ward.
Thank you. Dr. Beale.
Good afternoon. I'm John Beale. I chair Health Watch Leeds, and I'm a co-opted member of this board.
Thank you for always being here, Dr. Beale. Councillor Burke.
Good afternoon, Sharon Burke, Councillor for Middleton Park.
Thanks for joining us. Councillor Farley.
Luke Farley, Labour Councillor for Bermondsey and Richmond Hill.
Thanks for joining us. Councillor Gibson.
Good afternoon, everyone. Councillor James Gibson, Crossgates and Winmore Ward.
Thanks for joining us. Councillor Harrington.
Good afternoon, everybody. Councillor Harrington from Wetherby Ward.
Thank you. Councillor Iqbal.
Councillor Mohammed Iqbal for Hunslet and Riverside Ward.
Thanks for joining us. Councillor Taylor.
Hi, good afternoon. Councillor Taylor, represent Chapel Allerton Ward.
Thanks for joining us. And Councillor Thompson.
Good afternoon, Councillor Eleanor Thompson, representing Guiseley and Rawdon Ward.
Excellent. Thank you, board members. I will now ask supporting officers to also introduce themselves, please.
Thank you, Chair. Good afternoon, everyone. Rob Clayton, advisor to the board today, standing in for my colleague, Angela.
Good afternoon, Toby Russell. I'm clerk to the Scrutiny Board. Thank you.
Thank you very much. I would now ask Toby to go through agenda items 1 to 5. Everybody got the agenda and all the papers? Is that a yes? Fabulous. Thank you, Toby.
Thank you, Chair. Under agenda item number 1, there are no appeals against the refusal of inspection of documents. Under agenda item number 2, there is no exempt information which would exclude the press or the public. Under agenda item number 3, there are no formal late items noted. Under agenda item number 4, can I ask members to declare any interests? None. And under agenda item number 5, apologies for absence have been received from Councillor Kidger and Councillor Harbrook. Thank you.
Thank you very much, Toby. Agenda item number 6, minutes of the last meeting, which was held on the 22nd of November 2022. Any matters arising from that, please? Very good. Okay. Do we accept that as a correct record of minutes? Members, could I get a nod, please, and a smile? Great. Thank you very much. Right, straight to agenda item number 7, and that's on health and care workforce. Very, very important. So could I actually, before I start, I'll ask those who would be speaking on this agenda item to quickly introduce themselves, please, if you don't mind.
Hello, I'm Kate O'Connell. I'm the Director of Health and Care Academy in Leeds and will be leading the item.
Hello, my name's Laura Smith. I'm Director of Workforce for Leeds Community Healthcare and the Leeds GP Confederation. Thanks for having us today.
I'm Councillor Fiona Benner. I'm the Cabinet Member for Children and Adult Social Care and Health Partnerships.
Hi, I'm Councillor Salma Arif. I'm the Executive Member for Public Health and Active Lifestyles. Can Can I just thank you, Chair, for the fruits that you've bought. As the Cabinet Member for Public Health, I wholeheartedly approve. Thank you.
You're very welcome.
Good afternoon, everybody. Victoria Eaton, Director of Public Health at Leeds City Council.
Kath Roth, Director of Adults and Health for Leeds City Council.
Good afternoon, Shona McFarlane, Deputy Director, Adults and Health.
Good afternoon, John Crowther, Chief Officer, Resource and Strategy, Adults and Health. And Phil Evans, Chief Officer, Operations and Active Leads in the City Development Directorate.
Thank you all for coming. Truly appreciate it. Okay, so the Leeds Health and Social Care system continues to experience an unprecedented demand on all of its services. And therefore, as a scrutiny board, we did agree to consider the current challenges relating to the health and care workforce and the strategic approach being taken to address these challenges. Partners are working together to understand and prioritize strategic actions required to strengthen the health and care workforce across Leeds, and this work is primarily planned and coordinated through the Leeds Health and Care Academy. To inform our discussion today, the board has therefore been provided with a briefing paper, which I believe each and every one of you has got, and that has been given to us by the Leeds Health and Care Academy. So thank you very much for joining us. And I believe, Kate, you will be leading on the introduction and on this paper. Is that correct? Over to you.
Thank you. Hopefully you've all had a chance to read and digest the paper, but obviously what we're trying to cover here is a really large and complex partnership arrangement, which really tries to tackle health and social care together, and really focusing on the integration of our workforce to better focus around person-centred care rather than being constrained by individual organisational boundaries. So the benefits of working together are well established in Leeds, and it's not just about the health and wellbeing ambition for the city, but also about inclusive growth and making sure that we're getting the contributions and the benefits to all partners realised in practice as well as in intent. So within Leeds, we are taking a really proactive approach to that under the leadership of the Leeds One Workforce Strategic Board, which is chaired by Dr. Sarah Munro, who she's the Chief Executive of the Leeds and York Partnership Foundation Trust, so has a really key strategic role in the city to drive that integrated working. Under the board, we established the Leeds Health and Care Academy some years ago now, which is really a vehicle to enable collaboration to happen in practice and connect those partners together in terms of service delivery partners like our NHS trusts in Leeds, but also our educational partners, our VCSE colleagues, our independent providers, and the real complexity of the system that makes that delivery and provision for health and social care in Leeds. So in terms of challenges, where to start? They're absolutely enormous at the moment. We've had long-standing challenges nationally around health and social care from a workforce perspective, but then overlaid with the experiences of COVID, the cost of living pressures, the realisation of the impact of Brexit, and many other environmental factors which have really exacerbated some of those long-standing workforce challenges. We're also seeing significant change in demand. We've got backlogs to deal with. A complexity of needs for our population is also increasing. So some real drivers for us to work effectively together. But the solutions are not simple. We're seeing increasing numbers of vacancies. Turnover is high across all parts of the system. Our workforce are experiencing exhaustion, burnout from the pressures of the last couple of years, and in part trauma as well, which we have to recognise and understand how we can best support our workforce. And sadly, that's leading to some real challenges in continuity of care and long waiting times, delayed discharges, things that we absolutely want to avoid and mitigate wherever possible. Now, of course, these are not unique to Leeds. These pressures are around the country, and I think every city would reflect similar challenges. However, within Leeds, we also are a specialist centre as well. So it's worth recognising that we serve beyond our immediate population. We provide services for people from many other parts of the country as well. So collaboratively, we've come together to help manage that risk, but also to look for opportunity in this space as well. So it's not just about what individual organisations can do. Of course, they're really critical to serving their own communities and their own specialist areas. But collaboratively, how can we come together as a city to tackle those interdependencies and some of the things that we think we can do better by working together? So key to that is taking a prioritised approach and really understanding that we need to tackle things in some kind of sequence that allows us to really realise some of those benefits. It's also a balance between now and the future. So yes, of course, we've got to tackle the immediate challenges of our workforce, but we need to make sure as well that we're getting ready for the future needs of our population and planning in advance of that. So the work that's set out in the paper includes our approaches around the Leeds City Resourcing Group, which is about how do we make sure that we don't compete against each other for recruitment and retention, and actually how do we work together to make sure that we're prioritising particular services and needs of our populations. How do we level up around health and well-being? So making sure that regardless of which employer you work for, you've got the same brilliant access to health and well-being support as a member of our health and social care workforce. And particularly around narrowing inequalities. So working in particular local communities and working with community groups, with special interest groups, in a way that actually enables them to access better opportunities through careers in health and social care as well. We don't work in isolation in Leeds. We're very strongly connected with the West Yorkshire ICS, with the West Yorkshire Combined Authority, making sure that we're working with the Department of Health and Social Care as well. So finally, I just want to kind of bring to the attention of the board the importance of this collaborative approach and the need for this to continue over the longer term. It isn't something that we're going to resolve quickly, but we can see some very real progress of this approach and want to make sure that we continue to do that with your support.
Thank you very much, Kate. I do know members would want to come in here, but before I bring in members, could I ask if there's anyone from the team that would like to add to what Kate has said? Yeah, Councillor Venner.
Yeah, thank you. I just wanted to add a few comments which are really just drawing the board's attention to particular items in the paper or things Kate said. So it's referred in the paper to the fact there's not a national strategy for the health and care workforce, and that's been referred to by a number of the bodies that represent the sector, such as ADAS and the Local Government Association. And because of that, it makes it even more important that we demonstrate leadership locally in that vacuum. I think when you were referring to the need for the anchor institutions really not to compete against each other, actually one of the challenges that we have in social care is that there isn't parity in the salaries, and I know that's a national issue, that's not a Leeds issue, but I read somewhere at the weekend that frontline health workers can earn £8,000 more doing a comparable role in health as opposed to in social care, and that's really challenging because ultimately it's one workforce and the systems are totally dependent on each other. So I think that's a challenge when you've got nationally set pay scales, but that is the reality that people really often move from social care to health and not the other way. I think the paper does refer to the fact we have got a huge amount of resource in Leeds through the anchor institutions, and it's really positive that the paper refers to the responsibilities they have, like the reference to supply chains and purchasing ethically and purchasing locally, and also being good employers. So at a health and wellbeing board last year where we talked about poverty and the cost of living crisis, one of the chief execs of one of the trusts was saying they have a responsibility as employers not to add to that. So paying decent wages being ultimately how they would do that. But we do have that resource, and there's been some really good work as a result of that, like the hyperlocal recruitment that's referred to in the paper in Lincoln Green for Jimmy's and in Armley for Red Kite View, where the NHS has gone out to the immediate neighbourhood, which are both areas of deprivation, to recruit staff from there to work in the hospitals. Yes, I just wanted to highlight those points. Thank you, Chair.
Thank you very much, Councillor Venner, for that. Any more contributors? Yes.
Hi, I wanted to endorse what Kate said from an NHS Trust perspective, and also to agree with Councillor Venner, of course. It is a really challenging landscape at the moment. We are experiencing some labour market challenges, retention challenges, health and wellbeing challenges, such that we've never seen before in my 20 years in the NHS. What I did want to add, though, was that the work that we do with the Health and Care Academy and across partners gives us a real opportunity to leverage the resources of the city in the way that we perhaps wouldn't have had such a burning platform to do before. And it gives us opportunity to think about challenges of things like resourcing in a new way, extra impetus to our ambitions to leverage talent in different communities, encouraging a wider talent pool to come and move into health and care roles. And we really find that working with the Academy and across health and care partners is an excellent way for us to do that. So I just wanted to acknowledge the opportunity intrinsic in what is a really challenging time. Thank you.
Thank you very much, Laura. Okay, any other contributions? Okay, so back to you now, board members. The floor is now open for questions. Dr. Bill.
Thank you, Chair. Thank you very much for the Academy producing this. Just before I come on to this, though, can I just say something in addition to what Councillor Venner said? Not only do those who work in the NHS tend to earn more than those working in social care, but also they have the NHS pension scheme. And I think that's a very important part of the difference in their remuneration. So I think we need to bear that in mind. Many organisations involved, in fact, reading through, you almost get lost with the number of organisations which are all part of that network working together. So I guess my question is, some of it is already happening, but a lot of it remains to be happening. It's plans which are ready to be put into effect. When will you be able to come back and tell us how it's going and what has been successful and what perhaps hasn't been successful?
Thank you. Yes, I mean, it's very much an evolving picture. I don't think there will be a date where we can say we've done it. That's fair, I think. So I think so far the foundations are really strong. So we've got some really good success stories around staff portability agreements where we've been able to actually move staff to work in different parts of the sector. The narrowing inequalities work where we've secured over 130 people have secured jobs through those kind of local community engagement over the last 18 months. So we've got some real tangible outputs of things that are making a difference already. I think the key is that there's so much to go at. We need to be focused and we need to retain that focus and prioritisation. So our plan at the moment is around building on those foundations and really embedding them and making sure that they are continuously improving the situation rather than moving on to the next big thing, the next exciting thing. So I think there's a kind of I guess a responsibility for us to continually come back and report to you as colleagues around what's working and what progress is being made, and to be really honest and open about where the challenges are and what doesn't work. And some of this is really important, that we are pushing boundaries, which means that not everything will work. You know, we've got to kind of test and try new things and try that innovation. So from my perspective, very happy at any point to come back and you know, describe and talk about some of those challenges and where we're making real progress.
Thank you very much, Kate, and definitely we'll have a hold watch on this and definitely invite you back to update us. Excellent, thank you. Any more questions, members? Yes, Councillor Burke.
Thanks, Chair. Can I ask about the initiative to expand technology to support people in their own home? What does that look like? And because it sounds fantastic, but I'm not sure how that would work in reality.
I'll do my best to answer it. It's not a project I'm massively close to, but we have a project in the city called 100% Digital, and we work with that project, and they've got all sorts of different strategies to improve people's access to digital. And so some of it's about the kit and some of it's about the skills. So, for example, I know our libraries lend tablets now, but we've got organisations like Leeds Older People's Forum, and a number of our neighbourhood networks will do digital skills sessions with people. During the first years of COVID, the number of tablets that the Carers Association had, Carers Leeds had, expanded, and they do things on digital skills. But also our local care partnerships have done a really innovative piece of work, just mapping in each of the local care partnership areas where people might be able to drop in and either use computers and or have free Wi-Fi and or be supported in their skills. So there's now like a little digital map of where you can go. So that's just some examples. In terms of the paid workforce, that's something the council is looking at as well, because I think there is so much potential in digital, and probably all of our children and grandchildren are better at it than the older generation. She said, just slightly stereotyping, but I think there is something about constantly supporting the workforce to keep abreast of what digital innovation can support. So, for example, there's a big push at the moment on developing a digital social care record. And we have a pilot project where we can support 5 care organisations to go through the process of, you have to have a level of digital competence and security before you're even allowed to introduce a digital social care record. So we're supporting a number of organisations just through that process. That's just a little example of some of the things we're doing.
Thank you very much, Kath. And one of the things that we actually have seen from COVID as well, I know you did mention the gap between younger people and older people in terms of digital. It's amazing what our elderly population have learned over the last 2.5 years. No day goes by without my mom not mentioning Zoom, which in her previous life, no way would she have known that. So one of the good things about digital and our population now in terms of, yes, we know the young ones are quite savvy, but I think the focus that has gone into making sure elderly people catch up and get connected whilst we were in lockdown and, you know, we couldn't see each other must be mentioned and say, thank you. And that's definitely a positive in these very difficult times. Right. Okay. Any other question? Yes, Councillor Good.
Chair. And thank you for this report as well. It is good. And I think Leeds does tend to be on the front foot when it comes to sort of future proofing. And this is sort of demonstrative of that. But you can't open a newspaper and read about the NHS without hearing about integration. For the past 10 years, it's integration, integration, integration. And indeed, in this report itself, I did a quick search and it's mentioned 192 times in the report. So, but it seems that integration and collaboration is used sort of interchangeably. And I wanted to know where we are truly being integrated as opposed to being collaborative, and going forward where you see more integration as opposed to collaboration. And because it's an important point, because everyone talks about it, but are they using integration to mean collaboration? And they are completely different things in my book.
I think you're right. And I think there's two arms to this. There are processes. So when do you have an integrated process? And I would use hospital discharge as an example of an integrated process where there are multiple agencies involved from the front door to the back door and back home. And then there's integration in terms of just how you plan and deliver your services. So we being Leeds City Council, are working very closely with our colleagues in Leeds Community Health on 4 projects that I would say are integrated. So there's the transfer of care hubs in St James's Hospital, where it receives discharge notices, triages what's the best route out and supports it. So that's a multi-agency, multidisciplinary team that works in an holistic way. We've got our recovery hubs that we deliver together in partnership. So again, it was an innovative model back in 2016 where Leeds Community Health are the lead partner, using our establishment, so our refurbished older people's homes that are focused on recovery. They provide the nurses, we provide the registered manager and support staff. That's an integrated delivery model. We are also working on integrating our reablement service with LCH's intermediate care service. Stage 1 of that's already happened. So each service had a planner who rostered their workforce, but they did it like parallel play. Now they sit together physically we've got 3 hubs across the city, and they plan together. So we might be able to do the morning bit if they can do the afternoon bit, and it is greater than the sum of its parts. When you do that, we make a better use of the capacity. And then the next stage of that is actually then looking at the workforce. So we have reablement officers, they have therapy assistants, they're roughly paid the same. Should we not start to develop a concept of a generic therapy support worker? I don't know, choose your title, but it's starting to look at rehabilitation skills that span social care and health. And then the 4th thing we're working on together, which is genuinely will be an amazingly integrated service, is the transformation of home care, where we envisage a sort of provider collaborative between ourselves, Leeds Community Health, home care providers and the third sector to create a community health and wellbeing service. And I could do a whole scrutiny session on that ambition, but those are just 4 examples of where we are genuinely integrating.
Thanks for that, Kath, and that's good stuff. What do you think have been the challenges with integration? And we've seen in some areas actually that there's been a backward steps. When I first started, so not necessarily in Leeds, by the way, but when I first started in social work, I finished, by the way, last Tuesday. I'm not longer a social worker, so I can't say that. So when I first started, I worked in a different local authority with a team, a learning disability team that was integrated. We all sat together, the psychologists, the social workers, the nurses, and the OTs, and it worked really well because it created that really good collaborative working sort of environment ethos, and we're all in it together. As soon as we split up, then it became a little bit more us and them, a little bit more sort of gatekeeping and the rest of it. So why, and that wasn't that long ago. Why have we seen backward steps, and what's the what's prohibiting us actually moving forward with further integrations in other teams like learning disabilities and things like that?
Shall I start, Councillor Gibson, and then pass to Kath? We are seeing some real successful integration of teams together, working across organisational boundaries. Social workers sitting with our community nursing teams is a really good example of where physical proximity can really underpin a shared culture, shared teamwork. We do, as you've rightly pointed out, see greater challenges in working alongside one another in an integrated way when we're sitting in different buildings, where we also work with different terms and conditions and may have different cultures or microcultures. Things like the Workforce Portability Agreement, which is, I think, fairly unique to us in Leeds, are really helping us to smash down organisational boundaries in terms of enabling people to work across boundaries, regardless of their terms and conditions in their host organisation. But it is overall, for me, where we see the greatest success is where people feel culturally one team. And we work really hard to talk about one Leeds workforce in terms of health and care. And that's a branding opportunity, and I think a USP for the city that we've really got an opportunity to leverage going forward. Kath, I don't know if you want to say more about learning disabilities in particular or anything else.
Our learning disability teams are currently co-located. So I don't know where that sits on your spectrum of true integration, because I think often people envisage integration as a structural integration where it's got to have the characteristics of one line management and one brand. And I think we realise our world is a wee bit more complex than that. So sometimes you can have co-located teams who still have autonomy, you know, they're separate employers, but they work together in such a collaborative way. The citizen experiences that as an holistic integrated offer. And I think, you know, one of the litmus tests for me is what's people's experience of the service, and the bit about the wiring behind it really is for us to sort out. Similarly with mental health services, you know, we have aspects of co-location. And I've worked in a number of places where adult social care mental health had been transferred over to the mental health trust, and every single time I've had to pull them back because they lost their professional identity, they weren't supported adequately enough around their professional development. So you know, sometimes you go into such a big thing, it can sort of overwhelm you as a social care person. So it's just getting the balance right with some of this. But I agree with Laura's opening comment. Culture above anything is the most important thing to establish around you know, a genuinely integrated offer. And if you don't have your culture right, you can't really progress.
Thank you very much, Kath. You happy?
Well, I just wondered what the hindrances were to that work. If you want to
ask, that's why we're here.
Back to what have been the hindrances to that progressing. What you've just, everything that you've explained is absolutely fantastic, and I totally agree with. But what's prohibited that?
I mean, some of it is pay. Again, when I was director at Ealing, I had an integrated service. Some team managers were social care, some were health. The health ones were paid 2 to 3 grand more, and it really cheesed off my social care people. So pay terms and conditions can really make a difference in terms of barriers to integration. Sometimes it can be the choice of services of the organisation. You know, does this local authority want to transfer out its own in-house services over to the NHS or not? You know, there are political choices around how you do integration and what it looks like. So, you know, I wouldn't call it a barrier. I think it's a choice.
Yeah, I think also Cass described the kind of local situation very clearly. I think there's some national contextual issues which are genuine hindrances to this. So we are working as Leeds partnership with the Department of Health and Social Care to help understand the decisions around policy and funding, and what integrated policy and funding looks like between health and social care, and how that actually plays out in a real live place with real people, because I think that's that's really at the heart of making some of this stuff work. I think in Leeds we've been very good at being creative and looking at innovative ways around things and how we can get past them. But ideally we'd remove the barriers and then we wouldn't have to work around them. We'd actually tackle it at source. So I think, you know, we're in a really good position in Leeds to provide that evidence base for DHSC and other national bodies, including National NHS England, Skills for Care, those kind of bodies. And we do build those relationships deliberately to try and influence and give some reality to what those decisions mean.
I was just going to add one final challenge is around the fact that social care services are mainly means tested and charging, and the fact we charge can really get in the way sometimes, and is something that butts right up against NHS services free at the point of delivery.
Thank you very much. Yeah, you happy? Okay, Councillor Farley.
Thank you. So obviously there's been a lot of conversation nationally about increasing the size of the workforce. I distinctly remember something about 50,000 extra nurses a short while ago. I understand that part of that is looking both domestically and internationally in terms of how do we increase the size of the workforce. So quite a specific question. What does international recruitment look like in Leeds, and how are we looking at specific areas to be targeted? For example, midwifery, mental health nursing, where there's a clear deficit in terms of people joining the workforce. And then as an addendum to that question, how does this then compare to local domestic efforts? I understand that there's been a programme in Lincoln Green, which is part of my ward, so I do have an interest there. And how are we attracting to those roles that are less desirable?
Thank you. So international recruitment's a really interesting area because it's quite fraught with tensions, as you can imagine. West Yorkshire integrated care system is quite at the forefront of international recruitment, and doing that through long-term valuable partnership arrangements rather than the kind of agency-based recruitment that some sectors use. So it's very much about building those long-term reciprocal partnerships with different areas around the world where there's a mutual exchange of education and as well as that linked to international recruitment. Within Leeds teaching hospitals have been very active in international recruitment for some time, so they've got quite well established pathways, and over the last couple of years we've been exploring how we open that up to make that a collaborative approach. So specifically joining with Leeds Community Health to do a kind of joint approach to that international recruitment, and more recently within social care as well, so really exploring all the different roles and the workforce needs that we have, and how those partnerships can be utilised to build that international pipeline. I think we've got lots of learning around international recruitment, particularly about the support required for people as they come over, as they start to find their feet in society and the kind of local communities that they come into, as well as that longer term career progression and retention, and thinking about all of the challenges that they as individuals face. So it isn't without difficulty, but we have made some firm kind of steps forward in making sure that that's a more successful approach collaboratively. I think it is really challenging for specific hard to fill vacancies. You know, it works well for adult nursing, for example, because it's a very broad, there's lots of different opportunities and it's quite a broad profession. But when you get into those more specialist roles, it is absolutely more challenging. And so we're starting to explore what different relationships we would need to target some of those more specialist roles, such as maternity you mentioned, and some of the mental health recruitment as well is very specific. So yes, sorry, I forgot your second question.
Yeah, it was just following on from kind of the conversation around international recruitment. Kind of how do international recruitment efforts and it feels like there's international recruitment happening, but nothing particularly specific. Does that sound fair?
We do have specific programmes around international recruitment. So yes, we've got a 2-year plan in place at the moment for City of Leeds, which includes Leeds Teaching Hospital, the LCH, the council as well.
So just on that, what are the objectives of that? Do you have like a specific number or target of staff that you want to bring into the workforce, and what's the shape and nature of that?
So the organisations that are working together on international recruitment, each individually have a number that they seek to recruit. We look to do it collaboratively where possible. We're looking to share, for example, the sort of cultural and pastoral induction packages that we put in place for people. In my own organisation at Leeds Community Healthcare, we were successful in bringing in 7 international community nurses last year for the very first time, which is indicative of what Kate's saying. We're expanding our reach on international recruitment into areas we haven't explored before. In Q4 of this year, we're looking to bring in a further 30, which is indicative of our ambition to expand that market. I would just want to put a counterpoint to that, which is that we also continue to really focus on our domestic recruitment, both inside and outside Leeds city boundaries. This Friday, for example, we've got representatives from both Leeds Community Healthcare and Leeds Teaching Hospitals going into Leeds Beckett to talk to the undergraduate nurses there, in the hope that we can really maintain our local talent pipelines. And we're also doing plenty of work with the help of the academy with other education institutions, including schools, for example.
Thank you. Yes, I suppose that the second part of that, my original question was how does it compare to local domestic efforts? Now you sort of gone into that, and I appreciate kind of for it's, you know, I was going to say it's easy. It's not necessarily easier, but if you're going around the world and you've got fully recruited nurses, that's slightly different to recruiting people onto, say, like a band 2 clinical support worker. But how are we obviously working with the universities to, and I suppose working with schools to encourage people into healthcare roles that maybe require a degree education?
So it's a really crucial area. So as part of the partnership and the Leeds One Workforce Board, all of our 3 universities in Leeds are represented on there, as well as the University Centre from Leeds City College as well. So they are intrinsic to our strategic planning around workforce, and they have a voice at the table to help shape what that looks like. Obviously, we work very closely with Health Education England to make sure that we're getting the right placements, the right funding, that we can really support the workforce that we need within Leeds. But we can see that there's still a gap. So I think it's fair to say that we know that the undergraduate placements in the traditional sense are not going to fill all our workforce needs, and we've mapped that through collaboratively as a city, so we've got a good understanding of where those risks sit and what the challenges are. So as a result of that, we've started more specific work around apprenticeships in particular, so really understanding the whole pathway of apprenticeships. We've had the opportunity to work together around T-levels as well over the last year or so, which has been fantastic. So really starting that journey earlier, not just waiting till somebody's at the age where they're starting to look for a job. And our colleges and Notre Dame sixth form as well have been really crucial in working collaboratively around health and social care T-levels and making sure that we are joining that up locally. And then the apprenticeship pathways, as I say, are really critical. And it's not just that pre-registration apprenticeship, i.e. the step that makes you into a qualified nurse, but it's all the way through. How do you take the next step on your career? And then once you're a registered professional, where can that take you as well? So it's looking at all of those steps which can be facilitated by apprenticeships. We've got lots of examples of sharing the apprenticeship levy across Leeds organisations so that we can do that together and get those apprentices in the right place. And we've got some great success stories for individuals as well.
Thank you very much, Councillor Harrington.
Thank you, Chair. Just wanted to ask about the flexible working design. Now, we know that there's been a lot of changes throughout COVID about people working from home. How do you see that actually impacting on your recruitment of social care workers and health professionals? Because it's a little difficult for a care worker. They can't work from home. So what are the kind of issues that you're going to be looking at about giving them some flexibility? Thank you.
I'll start with that and then hand over to Laura. So in terms of, you're right, if you're a care worker, you need to deliver hands-on care, you need to be in the house with the individual. But we are looking increasingly at the role that technology can play. Also, that might mean that you don't need to go actually physically into the house. So there's all sorts of gizmos and gadgets around that support people to talk to one another, not necessarily Zoom, but there's a company called FOSS that have got a screen like a telly and you turn it on, it's that easy. And you can chat with somebody. So rather than turn up and do a medication prompt, you can just dial in, chat to them, say, Margaret, it's time to take your pills. Can you go and get your pills? And I'll watch you take your tablets. You can do that, things like that. There's remote monitoring we can do now around movement. So in the past, you might physically go in and check on somebody. Now we've got the technology that can say, we can tell somebody's got up, they've opened the fridge, they've put the kettle on, clearly probably made breakfast, it's okay. So I think there's things like that. Obviously with social work, excuse me, we had to really innovate during COVID. So I think there's much more now that we're able to do over telephones. There's always a judgment. We know at times we need to be in there seeing the state of the home. So it is a judgment call. We also found with our financial assessment team in the past, we used to go to people's homes. Actually, people are quite happy to just send us stuff. We don't need to go and collect things. People scan and email it in now. So again, we can do things more efficiently and effectively. Hand over to Laura.
Building on what Cass said and thinking in particular about the flexible working project that's part of the City Resourcing Group suite of projects. One of the things we're really conscious of, and I speak as SRO of that project, one of the things that we're really conscious of is that we are working to support a huge range of different services and organisations that all will have different requirements for their own services and the people who use those services. We're looking not just at where work is done in terms of flexible working, but also where and when work is done. So working patterns, as well as the opportunities for remote and agile working. Our aims are to not only make sure that all of our organisations across health and social care understand what the legal requirements are and what the opportunities are in terms of flexible working, but that we understand what our prospective and current workforce wants from a workplace, because it is a buyer's market in terms of employment, and what the cultural barriers are amongst our employers that are preventing us from offering what our prospective workforce wants. So the classic is, I can't allow this person to take every Friday off in order to fit with their outside of work commitments, because then I'll have to give it to everybody. And those are the kind of myths that we are looking to bust through this programme. So we don't have direct control over how the organisations in health and social care in the city implement flexible working. But what we hope to do is really show people the art of the possible through use of case studies, tools, and some clever sort of resources to help people really think about the art of the possible, and hopefully use that to expand our talent pool.
Thank you very much, Laura. You happy? Great. Okay. We would need to move on to the next agenda now. So a huge thank you to Laura and to Kate as well for coming. And like I said earlier, we will keep a holding watch, and we will definitely invite you again to update us. But thank you very much for this very comprehensive report, and we are grateful. Thank you. You're happy to stay. It's a very lovely board. So, but if you've got other things to do, please, by all means, feel free to leave. But thank you. Okay, agenda item number 8 is on the Best City Ambition update. It's been a year since we were sat around the table listening to the plans, and it's just nice to know that we can come back and ask yourselves, to just give us an update on all the work that has been undertaken to implement the Best City Ambition, which was obviously adopted at full council in February of 2022. Is there anyone joining us that hasn't introduced themselves on this item? Mike, is that you? Can't see from here. Yeah, that's you. Great. Okay. Every other person has introduced herself. So if you can introduce yourself, and then I think you're starting off. Is that right? Fab. Okay. Over to you.
Thanks, Chair. Hi, everyone. My name is Mike Eakins. I'm the Acting Head of Intelligence and Policy. Here to talk to you today about an update on the Best City Ambition. And as the Chair's just indicated, and members will remember, the ambition was adopted by full council last February. And at the same time as we adopted that, council agreed that the current year would be a transitional year when we would move from on a whole range of things, from the arrangements we had in place for the previous Best Council plan to what we want to have in place going forward for the Best City Ambition. The report in front of you today is really a relatively high level overview of that transitional activity and the implementation of the ambition. So I'm just going to, I'll assume obviously people have had a chance to look at the paper, so I'll just briefly touch on what it covers. So before I do that, actually, the first thing to mention is members hopefully will be aware we had a recent LGA peer review at the back end of last year, and we got some feedback on the ambition through that process, which was really encouraging actually, and demonstrated that both within the council and the wider city, there's already quite good ownership of the ambition, which I think is testament to the way that everyone has done on it, really. There's a lot further to go, but we were pleasantly surprised by how much progress has been made in quite a short period of time. So in terms of those implementation strands, the first that we've been looking at is our broader strategic framework that we have as a city and as a council as well. And members may be aware that the council has quite a lot of strategies, and I think probably broad agreement, slightly too many in some places. So we've been going through a process really of looking at what they are and, where possible, trying to put plans in place to bring them together. That won't be done in any sort of big bang way. It will be iterative as things come up for renewal, to just examine them and look at whether they need to be renewed in that current form or whether we could do something slightly different. So that process has been ongoing, and to help us with that, we with Cabinet Exec Board have had a discussion about what are the key strategies around which we can coalesce. And the paper notes some of those that we've agreed. I should say they are only the sort of more externally facing strategies. That doesn't cover things that we have internally or about our own workforce, etc. But as a starting point, we thought we'd try to build around these things, and you'll see several of those are relevant to this board. We've been doing a similar exercise off the back of that, looking at the partnership structures we've got in the city and trying to just ensure that they're fit for purpose. I would say certainly around health and wellbeing, the health and wellbeing pillar of the Best City Ambition. Obviously, a lot of those arrangements are statutory, and certainly with the Health and Wellbeing Board, etc. And I think really rigorous. That's not necessarily the case right across the picture. So we're working with colleagues and Leeds on those pillars about how we could potentially improve the partnership arrangements that we've got in place. And the team leads approach in the ambition is really guiding how we do that. The appendix to the paper provides a brief update on the breakthrough priorities as well, which were launched as part of the Best City Ambition last year. And all 5 of those are progressing well at a slightly different pace, naturally, as you would expect, being done alongside other activity. A couple of those fall within the remit of this board, and happy to take any questions and come back to the board with more detail on those as needed. And then the sort of final thing I really wanted to mention was around the work that's going on at a community level. And the paper mentions the idea of local area plans, which our colleagues in the Communities Directorate are working on. This is something that came out quite strongly from the peer review as well. There's loads of good work going on at a community level in the city, but probably more opportunities to bring that together and to integrate, sort of referring back to the previous item a little bit more. And that includes with, local care partnerships, community committees, locality teams, etc. So there will be a programme of work coming out of the peer review that's already pretty well aligned with what we said we want to do in the Best City Ambition. So an opportunity to really accelerate that over the coming year. And I know all members will be engaged in that process, certainly initially through community committees, at some point later this year. And then very finally, before I sort of pause for questions, the paper also touches on changes in the transition on performance arrangements. I wasn't going to go into too much detail because I know the next item is on performance, but just to flag that what we are looking at is a new set of KPIs for both the Best City Ambition and the organisation itself and how we work as a council. And in the next item, you will see a very, very first draft of a new Best City Ambition dashboard to monitor the longer term progress towards the ambition, and that will be looked at alongside the new Leeds Social Progress Index. So just to flag that is there, it's included in the papers really as an indication of the direction of travel. It's not a final document, and eagle-eyed among you will notice there are some indicators in there that are duplicative of the wider performance reporting that you've got, and in places use slightly different metrics. So the next stage of the work on that is to work with colleagues across the council and with scrutiny boards to make sure that we're aligned and those things become integrated before it comes back to you again in June. Happy to take any questions. Thanks, Chair.
Thank you very much, Mike. You just saved yourself there because I was going to ask you a question on the SPIs on page 19. So if that's going to come in your performance update, then yeah, I'll hold fire for now. Board members, any questions for Mike? Oh, wow. Amazing. Good job, Mike. Right. Thank you very much. Oh, there is. Dr. Beale, of course.
I promise I won't ask questions for every item on the agenda this afternoon. I just wanted to pick up the bit about promoting mental health in the community. And it talks about being delivered by humans being in consultation with third sector partners and public health. And they are, of course, both groups and person who are very important. But I just wondered about whether GPs are involved at all, and in particular, possibly with social prescribing. That's a bigger topic, and maybe that's something we ought to look at in more detail at another occasion. We haven't got a GP or anyone concerned with GPs here, but I just wondered if you were able to say, are GPs playing into this at all?
Thanks for the question. Yeah, so at this stage, that's in a pilot form, and as far as I'm aware, at this stage, no. That said, what we are looking at is we're monitoring that pilot as it goes along, and I think so far we've seen relatively good results from that. And so now the conversation is turning to how might this become something we can do more of in the longer term, and that's where I think a broad range of partners, including GPs, but others too, we're actively thinking about the role broad range of organisations might play, both with their own staff, but also their customers as well. So as we move into that longer term conversation, I think it will broaden out and a wider group of people will be involved.
Thanks very much. Can I suggest, Chair, that we at least consider whether we look in more detail at social prescribing at some time?
Sure, Dr. Bill. Okay, yes, Victoria.
Just to add to Mike's comments on that question, because we are very involved in this from the public health team. The breakthrough project is because there's so much going on with GP practices and with mental health across the city. The rationale around this work is to actually add more to what we're already doing rather than doing something completely separate. So the breakthrough bit of the new work of the programme is not directly involving GPs, John, but all of the rest of the work that the wider programme does. So it will join up and sit alongside and connect with social prescribing. But the added impetus of doing this additional work is very community focused, really as a response to what we're really seeing in communities around that longer term mental health impact of COVID. So it's meant to be sort of additional and enhanced work, which absolutely will connect. But the extra breakthrough bit is very, very community focused. But yeah, we're happy to bring back more of an update on that. That's helpful.
Excellent. Thank you very much. So my last question, Mike, will be on page 35 in using the ambition to shape our narrative. In particular, I'm making reference to poverty and health inequality. what engagement in terms of activities have you particularly carried out to tackle that?
Thanks, Chair. So yeah, from its inception, really, the idea of the Best City ambition was to really codify that tackling poverty and inequality ambition that the council and the city has, and to make sure that feeds through the 3 pillars of the ambition. So obviously tackling health inequalities through the health and wellbeing strategy, but there's a new inclusive growth strategy coming this year as well, in which the tackling poverty and inequality message we expect will be, it's in there already, but will be boosted further. And certainly a lot of the work that goes on around zero carbon is focused on those lower income communities as well. And you see through things like the district heating scheme that a lot of lower income communities have benefited from that work. The other thing I'd probably mention is we're actively talking to Tim Fielding and the Marmot work that's kicking off. And when we refresh the Best City ambition later this year, there'll be a really strong opportunity to bring that in much more wholeheartedly than it's in there currently, and to place the Best City ambition and the Marmot work very clearly in partnership in terms of pushing forward that agenda on tackling health inequalities.
Okay, thank you very much for that. Right, we shall move on to the next agenda. I think, Mike, I'm sorry, I can't tell you can leave because you will be part of the next item as well. And that's on performance update, adult social care, public health and active lifestyle. So I can see we've got contributors to that agenda who are coming to sit down, and it will be great if you could kindly introduce yourselves, please.
Chair, I'll start. Tim Fielding, Deputy Director of Public Health.
Thanks for joining us.
Robert Wood, Intelligence and Policy Manager in Adult Social Care.
Thank you for joining us. Anyone else?
Afternoon, Stephen Baker, Head of Active Leeds.
Thank you for joining us. Okay, and I believe every other person on that item has introduced themselves. Okay, so this report provides an overview of outcomes and service performance related to the council priorities and services within the remit of this scrutiny board. So there are 3 distinct sections which we know this board looks after. So public health, adult social care, and of course, active lifestyle. And therefore, it is proposed that this board considers these in turn to help structure our discussion this afternoon. And I would love to start with active lifestyle. So I believe who's starting that? Will that be Councillor Arif? Over to you.
Thank you, Chair. I've just got some introductory notes, if I may. Firstly, I'd just like to advise on an amendment. In the performance report, the active Leeds, it says Leeds now has one of the lowest inactive rates in North Yorkshire. This should, of course, read Yorkshire and Humber, just to clarify that. So the report highlights that activity levels are continuing to recover following the large drops that caused by the pandemic restrictions. There are more people active now than the first survey's findings, which is a testament to obviously the work and investment that went into helping people stay active during this very difficult period. Leeds now has one of the lowest inactivity rates, as I mentioned, in Yorkshire and Humber, and it's the second best in relation to core cities, only behind Bristol, which is one of the best activity rates nationally. Leeds inactivity rate is also substantially lower than the national, which is, I believe, 27%, and the regional 28%, and the core cities, which are 26%. Averages, which needs to be obviously celebrated. Despite that, despite the good news, numbers are still down compared to pre-pandemic levels, and it's been most acute in our more deprived communities and groups where we've got higher deprivation, which is why we've got a strong focus on tackling health inequalities, and by especially through the public health and active Leeds, we are leading on through the physical activity ambition. I'll leave it at that, Chair. Thank you.
Thank you very much, Councillor Arif. Members, do we have any questions for active lifestyle? There's so many of them here, so let's do what we do. Yes, Councillor Berwick.
Thanks, Chair. It's a really simple question. With the impact of cost of living, obviously attending the gyms and everything is becoming an issue for some people. And of course, we want to promote that. And I know we need the revenue, so it's a bit rock and a hard place. Are there any plans or initiatives that we can promote in wards to encourage people to go and use the facilities more?
Yes, Chair, if I pick that up in the first instance, we are alive very much to the challenge of the cost of living crisis, and we'll probably pick up on this on one of the later agenda items in terms of fees and charges, that we had to introduce some fees and charge increases last year. What we did, though, however, was try to protect the most disadvantaged and the most vulnerable in terms of those fee increases, and so we minimised the level of fee increases for Leeds cards, Leeds Card Goes, Leeds Card Extra. So all those mechanisms that exist to try to make our facilities as affordable as possible were protected in the increases that we made last year. We've also been doing some work in looking at how we can actually do some more activity to get low cost activities for the most vulnerable and the most economically disadvantaged, and we've done some work on Armley, and there's a proposal that we bring that to the attention of members via a briefing with Councillor Arif, and we can make sure that members are cited on that.
Thank you very much. Members, just to let you know, this is also public health. So if you have any questions for Victoria, she's sitting nicely there as well. So feel free to ask questions. Yeah, Dr. Bill.
Yes, I will ask one which actually comes under healthy lifestyles. So I could have waited for public health, or I can do it under active lifestyle. And that is the rate of obesity. If you look at the page 47, percent of people classed as obese. Just one word of caution, it looks as if Leeds is sort of bobbing up and down, but actually I suspect that they are fairly small samples from the survey. And if you drew the access from 0% to 100%, you will see that it's not very much up and down. It's pretty constant around 60%. Turning forward, we come across then children in year 6 with already at that stage a quite frightening, really, level of obesity. And then you come to the very young children, the primary school children going into school, and even them have a level of obesity which is quite frightening. So yes, Leeds is more active than many other places, but obviously, lack of healthy lifestyles is one of the factors. Diet must also be another factor. What are we doing to try and pull the prevalence down from the current level to what might be regarded at least as a better prevalence, if not ideal?
I'm happy to come in there, Chair. I'm mindful we have got some introductory comments for our report as well, so we can pick those up as we go. But just to respond to this question specifically, I mean, Dr. Beale pulls out a couple of critical areas there. I think the most stark one, which comes back with this report, was the last time we were here in June. We were commenting on quite a remarkable jump in reception aged, generally 4-year-olds in obesity, where we'd never seen an increase like it, which was kind of post-pandemic. You'll see from the data that the good news is that that's significantly improved now. So that's really bounced back to pre-pandemic levels. So that there's some very good news in the report around 4-year-old weight and obesity. I mean, obviously still work to do, and we're looking at the gap across the city still. The year 6 data, even though it has gone up a little, so this is top end of primary school, I think there was a general sense that we could have seen similar jumps to that we've seen in the 4-year-olds, and we've not seen that. So even though it's not showed such a marked improvements as the 4-year-olds, it is, you know, it's relatively, well, it's still moving slightly in the wrong direction, but it's more positive than it could have been, seeing what was happening with children generally. So and then, as you say, Dr. Beale, we've still got long-standing challenges around all age, healthy weight and obesity. And I think that in terms of, in very broad terms, our strategy across the city, both for children and for adults, we as a council have recognised that there's a whole different lot of factors that play into that. So there's not one single magic bullet around, you know, if we improve access to gyms or leisure facilities, or if we particularly do great things like I know we're doing through the food strategy. Not one single one of those interventions is the single difference. We know from all the learning from our work around children's healthy weight that quite rightly was nationally and internationally recognised. It was the combination of the fact that we've got so many different things happening. We've got children's centres doing fantastic work. We've got the Henry programme around healthy eating and nutrition for the very young. We've got all sorts of things that are kind of happening as a system and as a city that we're all very committed to. So we have, as a council, signed up to the Healthy Weight Declaration, which recognises that every single part of the council and the city has a role to play in looking at the whole environment in which people live, which is the main thing that contributes to healthy weight. And we particularly use the phrase around healthy weight because it is more positive than just talking about obesity or overweight. And we also know that through pandemic, we are seeing an increased proportion of underweight children and young people and adults. So it is. So in broad terms, we want a healthy weight strategy. We're already signed up to our healthy weight declaration. We need to regroup and review around the action plan underneath that healthy weight declaration. And there is streams of work that are happening both in the children's world to refresh the healthy weight action plan for children and the healthy weight action plan for adults, which are happening now post-COVID, and we can bring those back. I think the final comment on this, just for all of your interest, is that there is growing work nationally and internationally that we will be very engaged in about how we work more proactively with some of the industries that have the biggest impact on health. To really look at what are often called the commercial determinants of health, where companies look to minimise harm from some of the products, you know, so being really creative, looking at licensing in areas where we've got, you know, lots of fast food takeaways and lots of shops selling food, which is making it harder for people to live a healthy lifestyle. So it is about taking that really broad approach across the city. So I hope that's helpful. Thank you.
Chair, that's very helpful. Just to pick up that last point from Victoria, sadly, and I might be wrong here, but it seems to me that many of the fast food outlets in the city are in some of the most deprived areas of the city, and there is clearly a relationship there.
Thank you, Chair. One of the things I could have raised this under the last item, this item, or the next two items, but something that's going to go completely against health and well-being and stopping people accessing something that's actually free is the proposal that's being brought forward to charge for people to park in our parks and green spaces. That is not going to encourage people to get out and about in nature. It's not going to encourage young families to go to parks. And it's all very well saying get the bus, but you try getting the bus from anywhere to Otley Shevin and you just will not make it.
Who's responding to that? All right, is it on the same, sorry, Councillor Taylor, is he on the same? All right, you can use your microphone, please.
One umbrella. I'm going to start with active lifestyle first. Active lifestyle is absolutely brilliant, but with the cost of living, you mentioned you cut the price for gym. But we also have to take I go to a gym, we have to take into consideration you've got bills to pay. So it's how much can you cut? You know, it's only so much we can cut. So active lifestyle is a lot of activities. Councillor Anderson just mentioned the park that we have to drive. Leeds have some beautiful community parks where you don't have to drive. You can just walk. You just have to encourage the young people, adults, to walk. We have groups, elderly groups that walk. They can do that instead of getting, for instance, go to Roundhay Park. Of course, it's good to go to different parks, but there's so many local parks. It's only 5 minutes away and a lot of green space around some areas. Can't remember what I was going to say now because it's all puddled up. But Victoria is quite right with the diet. It's a balanced diet. Again, it go back to cost of living, school meals where the kids could eat school, but some parents cannot afford to nourish them. We know 1 meal a day is no good. We need 3 meals a day, especially breakfast. So they will get breakfast probably at school, wherever, and no meal. Again, we talk about licensing. We need to take the fast food, I said it time and time, out of the community. We need to work closely with licensing, how they provide it with the fast food. We need to not just focus on young people. As I says to the police, we're focusing on young people, but they have to go back home to the parents. We need to work with the parent as well. It's no need telling one kids, you can't have that. Go home, mom, fill the fridge up of chocolate and chips and whatever. It's a community issue and it's in for all of us to work together. It's diet activities. But again, I'll stress, Leeds have some lovely local park where the kids can go and kick ball. There's a lot of parks with equipment in it where they can do exercise free as well.
Thank you, Councillor Taylor. Yes. Mr. Barker.
Thanks, Chair. I just pick up on Councillor Anderson's point, and there aren't any colleagues here from Parks, but I'll make sure those comments are passported through, and I'm sure there'll be some discussion of that at Council in terms of the budget setting debate that's held there. What I would share with members more generally is one of the streams of activity that we're trying to do within Active Leeds is about working with colleagues in highways about active travel, and that's about doing the most local sort of activity. So how can we encourage more people to take physical activity in their home, going up and down the stairs, going out into their street, going up and down their street, trying to activate that. We can do where there are green spaces, where we can get people to walk to those green spaces or cycle to those green spaces and undertake that activity there. So there is a balance, I think, to be struck in relation to leveraging the green parks and the green spaces and parks that we have. But I will make that point to colleagues in Parks and Countryside, Councillor Anderson. Similar in relation to Councillor Taylor's point, I think we're very live to the challenge. There is a real balance, I think, in terms of how do we balance the council's need to deliver significant income from some of these activities. But one of the things that we are trying to do is to keep that very much in balance and try to protect, where possible, those people who are potentially most disadvantaged economically, so that they do have those opportunities that are afforded to other areas of the community. And that is at the forefront of our thinking. I can just reassure members on that.
Thank you very much. Councillor Taylor, is that supplementary question or a new question? Which one?
It's just the same, really.
Right.
I just think it starts from home. Parents need also to take the phones off young people. Sometimes they come from school and they're locked in their rooms. They need to encourage young people. Public health in Leeds, I think they're doing the best they can with what resources they've got. Leeds City Council have shared it the best they can, that make sure everyone have a slice of cake. But we need the community to work with us to maintain their health. It's our health. I don't expect anyone to look after my health. So we need education. But Leeds City Council can only go so much, I'm afraid.
Thank you very much, Councillor Taylor. Councillor Thompson.
Thank you, Chair. 2 parts, if that's okay. So for active lifestyles, if there is one thing that you would say has improved things in the last year? One measure that you've taken, one opportunity that's been taken up, what do you think has made the most difference and led to the most progress? And then public health, there is the food strategy, which looks great. What are we doing specifically about food deserts? So linking back to the fast food and the lack of availability in fresh food, would be good to hear a little about that if possible. Thank you.
Okay, Councillor Thompson, just to let you know that public health will come straight after active lifestyle. So if you can answer the question on active lifestyle, please. Thank you.
Thank you, Chair. There's numerous things, and just one is probably quite difficult, but in terms of how we actually work with the communities now is around how we co-produce a lot of our activities, and that's probably the biggest kind of impact that we've seen. About, you know, previously probably it was very much as we would go into an area, deliver some activities, then come out again, but it's very much around actually understanding what that community needs and support. It doesn't necessarily need us necessarily to deliver activities. As long as we give people the tools and the capabilities to be able to do it, then they can do it themselves. Plus, also, they know their communities better than what we do. So in terms of that aspect, in terms of getting people involved and other people and sharing that and that building that kind of knowledge base is probably the biggest element there. So it's around how we build people's capabilities to be able to do that, whether that's some training, whether it's some funds to kind of get them started and the likes. There's numerous groups that we've seen over this time that have grown, number of kind of initiatives that have done that through the actual communities themselves, not necessarily us coming in with ideas. So yeah, around that co-produce kind of activity is probably the biggest area that we've kind of seen make a big difference.
Thank you very much, Steve. You happy? Excellent. Okay, I've still got one more question for you, Phil. I'm really proud that Leeds is going to be hosting the marathon in May this year. I know there are two here, I can see them, who will be participating, Councillor Venner, Councillor Thompson, and myself. Who's the third? Oh, Councillor Taylor. Oh, right, I'm the third person. I thought it was you. I was getting excited too. Right, Councillor Gibson, are you running? You are running. That makes four of us, okay? My concern is the cost of it. So we're talking about tackling poverty and inequality. How can people who are not as privileged as ourselves take part in such a sport? We have amateur runners, we have elite runners, we have people who are trying to think, should I not? So if you think of that cost of going for a run or participating, I'm just thinking of the barriers and what are we doing as a council to encourage especially amateur runners to take part in such a beautiful event coming up in our city?
Thank you, Councillor. That's a very good question. I think it's probably helpful in terms of response just to set out that the event, the marathon, is something that the council is facilitating and supporting. We're not actually the organisers of the event. The event is being run is being organised by Jane Tomlinson's Run for All, who obviously deliver the 10K, deliver the half marathon and do marathons across the city. What I will do is I'll take that consideration back to them. I meet regularly with them on a monthly basis in terms of how we pick up engagement with that. So I'll take that challenge back to them next time we meet. I think one of the challenges realistically is that there's quite a lot of cost associated with the marathon in terms of the logistics and particularly the traffic management that needs to be put into it. And there is also the need to generate a significant sum for charity, because as we know, all the money, the money will be raised between LTHT charity and the M&D charity. But what I will do is I'll go away and have a conversation with them. And what I suggest, Councillor, is I'll drop you a note back to see what we can or can't do to facilitate that. What we are doing, even if we can't help with the funding, is we are planning some activity in terms of how we get some sort of preparation and advice to our most disadvantaged communities, so how they can actively participate. So I'll come back to you on the barrier of cost, But just to let you know also that we are planning on doing outreach work that encourages as many people in the communities to be able to participate.
Thank you very much, Phil. Now, the last bit of your answer is very comforting. So it's good to know that, because we do know we have a good chunk of deprivation where people would love to participate. And when I am asked, it's good for us to have answers and say, okay, alternatively, this is what we have in place. So that is really, really good to know. And I look forward to your email. Thank you. Councillor Arif.
Thank you, Chair. Just on the back of what Phil has just said, I think it's important for us for this not to be just something that's going on in one part of the city, and how do we make and leverage something out of it across the whole of the cities, particularly certain areas, certain communities, just get them involved, certain young children to say. So I think we've had a conversation about having a programme of events in the east, the west side of the city as well, so everybody, the whole city gets behind it, and that's something that we'll make sure we do. And it's just doing different activities, which means more people are out and celebrating it as well. Thank you.
Excellent. Thank you very much. Councillor Burke.
Thank you, Chair. I just want to go back to the food and obesity, and I'm sure this has been considered, but there's a thing about cultural awareness, isn't there? And different cultures have extremely different diets and different times of eating in different ways. So it's not always just a matter of eat more fruit or you're not having enough vegetables. I agree with all the comments about fast food takeaways and everything that my colleagues have made, but there does need to be some cultural awareness built into that dialogue as well.
Thank you. Any more questions from members? Councillor Anderson, just to let you know as well, the question on the parking and the parks, obviously that sits under housing and environment, but definitely some information will come out for
Can
you.
I just say though,
to yourself.
The director isn't here, but I would like to think that he consulted with Councillor Arif, with Victoria Eaton, and with the Best City people before he actually made that decision. So to say that there isn't anybody here that can answer that, I would like to think that they will be lobbying him to drop it.
Yes, Councillor Arif.
Just obviously, as you know, the council's been looking at a number of options to establish a sustainable budget for 23-24. One of those options is in relation to car parking. What I will say at this point is no decisions have been made, and obviously I take on board the points that you have raised, Councillor Anderson. What I will say at this point, the proposals will be consulted on, and all those comments that are being made, that are being fed to me as well, will certainly be reflected. Thank you.
Thank you. I'm glad to hear it.
Thank you. Back to you, Councillor. Now, I'm just going to take on public health now, because we still have adult health to consider as well, if that's okay. So public health, and now, is that yourself taking the introductory, or it's Victoria? Yourself.
It's me, yes. Okay. And then I'll come back on
over to you.
The takeaway point. So in relation to public health, the report summarises what we're doing as a city to improve health and address health inequalities. It shows our progress across a range of health outcomes and outcome measures, providing us with information about how these are changing over time in Leeds and faring against other core cities in the UK. It also includes an overview of the performance of key public health services, including sexual health and drug and alcohol services. In this report, public health services continue to perform well, including sustained high performance of NHS health checks and the completion of drug and alcohol treatment. Having said that, we may now be seeing the emerging impact of COVID-19 on the high level of health outcomes, such as life expectancy. There are small decreases in life expectancy across all groups in the city, which we will continue to track carefully. The rate nationally in other core cities also has decreased over the same period. In terms of the positives, some of the positive points to highlight, we've seen improvements in reporting on breastfeeding rates at 6 to 8 weeks, and the proportion of population that is physically inactive, as we've discussed, in Leeds is lower than for the England average. Inequalities unfortunately remain across a range of other indicators, including adult obesity, which we've had a conversation about, deaths associated with circulatory and respiratory disease and cancer. Finally, just to say, to note that the indicators in this report will be kept under constant review alongside the ongoing work towards becoming a marmot city. This will ensure that we continue to review our local progress towards improving the health of the poorest the fastest. Thank you, Chair.
Thank you very much. Any other contributors on public health? No. Right. Board members, any questions? You all happy? Excellent. Forever hold your pace. Right. We're moving straight to Councillor Venner.
Yeah, so
social care.
Yeah, the part of the portfolio that's that falls to me is the adult social care aspect of the performance report. And obviously we're very mindful that our figures have declined in a number of areas, and this is very much part of a national picture. And it reflects the huge challenges in adult social care at the moment, both with regard to increased demand and some of the challenges we're having around recruitment and retention. When we last had this data, we hadn't yet got the national comparators. So when we last discussed this at Scrutiny, we were aware that, for example, the domains around quality of life for both service users and carers had declined, but we didn't know if that was the same elsewhere. And we've now got the comparator, which shows this is very much part of a national picture, which isn't that surprising in a sense when you think about the time span that it's covering. I think most people's quality of life probably wasn't that fantastic coming out of the pandemic. On a more positive note, we are above the comparators with regard to people feeling safe and people feeling safe in services. And we do have a very dynamic and engaged and proactive Safeguarding Adults Board, which oversees that area of work. But the picture that's in this report is very reflective of the challenging context that adult social care is in at the moment. Thank you.
Thank you very much, Councillor Venner. Members, any questions? Wonderful. That's really, really good. I did promise our principal scrutiny advisor to my right, it's his birthday today. So I promise that we'll be good and finish on time. So if there are no questions, that makes us give him a good birthday gift. And now in terms of going home early. So that's great. Well done. Right. Okay. We will now move straight into agenda item number 10. Thank you all, partners and officers who have joined us. So feel free, if you're not on the agenda for the next item, please do feel free to leave, and thank you very much for coming. So the financial health monitoring for 2022 and 2023, obviously we're looking at October months 7 with this, and therefore it is proposed that these be considered together, if that's all right. Now, the item 10 includes a report detailing the council's projected financial health position for 2022 and 2023. At the end of October of 2022, and this is helpful in terms of also providing context to the initial budget proposals that are set out in item 11. Members are invited to provide any comment in relation to those areas that fall within our scrutiny board's remit. While members have already been initially consulted on relevant budget proposals as part of a working group meeting, which we had last month, this meeting provides a further opportunity for board members to raise any questions and formally capture any particular views and any recommendations that the board may wish to make to our executive board. So the outcome of the board's deliberation today will inform a composite report from scrutiny that will be submitted to the executive board for consideration during its meeting on the 8th of February. So I will ask, do we have anyone who's just joining us on this agenda item that hasn't introduced himself or herself? Please feel free to do so. Nobody? Okay, so who's starting off?
Hi, Chair. Excuse me. Hi, Chair. I'll pick up with the adult social care, public health, financial monitoring.
Okay.
Pass over to Steve and Phil, and then we can go through the budget action plan, plans, and savings plans.
And are you John, please?
John Crowther.
Excellent. Sorry. Yeah. Thank you very much.
Okay, so From an adult social care perspective, we public health as well. So we do anticipate and project we will deliver a balanced budget this financial year. That doesn't say there aren't a lot of ups and downs in there, and I'll briefly explain some of those. We have, as all directors have, a series of savings plans in year. We had 7 million in adults and health. We're confident we'll deliver 5.2, but we will struggle on around 1.7. I think it's really key to state that when we say we will struggle to do it, it is slippage, and some of the comments that have been made in previous discussions around being able to find people to do certain jobs is key in some of our plans. We took a decision to phase some of our income recovery, and that has affected. And getting people to do building works in our refurbishment of care homes has been an ask. So whilst it's disappointing to put forward plans that aren't delivered, from my perspective, I'm comfortable that those will ultimately be delivered in due course. Just concentrating on social care for the next couple of minutes, we have demand budgets approaching £250 million. And we have pressures in there of around about 5.4 million, primarily across residential care, a little bit in LD and home care. I think it's also key to say that some of those pressures are caused by in-year uplifts to fees, which have been funded through things like the fair cost of care funding that came from government. And we have had some betterment in some areas, particularly around direct payments and supported living. We've also, within that balanced position, we are taking a hit on the pay award, the unbudgeted element of the pay award, which is around about 2.4 million, although again, some of that is recovered because some of our partnership work. How is all that supported to deliver a balanced position? Well, we have had additional grant income through the Better Care Fund, and the full year effect of some of our previous income plans have come in much better than we anticipated. And there has been a general, although I mentioned a pressure around the pay award, it has been offset by vacancies throughout the year. In terms of public health, they operate within this current year around about £47 million ring-fence grant, and we are very confident that they will maintain their expenditure within those levels. But again, I think it is key to say that there are ups and downs in there, and like adult social care, still feeling the impacts of COVID and changes the way that we work, changes the trends of things that we work. I think that's broadly what I wanted to say on that. I'm happy to take questions now before I pass on to Phil and Steve if you wish, or you can take them at the end.
Members, is it okay to take it at the end? We just hear from Steve first, and then is it Steve? Steve, all right, okay.
Sorry, Chair, it's me again.
It's Phil, sorry. It's not Steve, members. This is Phil speaking now. Thanks.
So in a similar sort of situation as John has set out, in terms of the current year, it's been a challenging year for the service. Similarly, challenges around the pay award, and the Active Leeds service has also had the ancillary challenge of energy costs. And it'll come as no surprise to members that the leisure portfolio is the third most extensive user of energy across the council's estate. In terms of the position as a whole, the directorate is proposing that we're forecasting a balanced position at year end. At the time of writing for period 7, as set out in paragraph 3.63 at the end of page 112, the Active Leeds element of that was forecast to a £0.2 million overspend, so £200,000 was expected to be the overspend position. We're working very, very hard to improve that so that we get that down even further. But at the time of speaking, because obviously there's a lag in terms of this, we think there's a bit of betterment there, and we still think that the directorate as a whole will deliver a balanced position in the same way that John has set out will be the position for adults and health. Happily take questions.
Thank you very much, Steve. Kath, are you coming in on yours or?
Not on the budget monitor bit of it. I think John's
That's
explained
fine.
it.
Yeah, okay. Any other contribution? Members, I know we went through this in December, so don't think you have to ask a question just because you have to. So comments, questions? If you do not have, I am very happy to move on to the next agenda. You all happy? Yes. Can I get a nod and a smile? Fabulous. Okay. Thank you very much. Right. You all will be pleased to know on that item, the members are satisfied with what we have. So for bearing in mind, we went through a lot of this in December last year. So thank you very much for the report. Thank you for all that you have provided. We are truly, truly grateful. But before you go, it'll be nice for you to hear about the next item. Over to you, Rob. Oh, yes. Okay. So we've got the initial budget proposals for 2023. Who's speaking on that? We're not letting you off. Sorry.
They've been to you before. I think we've had working parties on it. So I think it's the opportunity for members for any last minute questions, clarifications, comments for officers to respond to.
I mean, we did go through in December, members. So, but if you have anything else that you would like to add, being extra efficient. It's his birthday, so let's let him off. All right.
Apologies, members. That was me
okay.
being, yeah.
Yeah, we're all happy. Excellent. Back to you, Rob.
Yes, thank you, Chair. So briefly on the work programme item, just to flag up, there is a planned working group on mental health that I need to send a date out for. Obviously, I'm not the permanent advisor to this board, but I will discuss that with Angela and ensure that's in your diaries as soon as possible. And then further to discussion today, I did note a couple of areas where work programming could reflect what was discussed today. And obviously, I will take that forward with Councillor Marshall Katung and Angela to ensure that they do feature either later in this year or in the next municipal year. Thank you, Chair.
Thank you very much, Rob. And our next meeting is the 21st of February at 1:30. Thank you all for coming. We truly appreciate it. We finished like almost an hour earlier. So it's a huge happy birthday to Rob again. And all of you have a wonderful afternoon. Thank you.
Chair, can we send our best wishes to Angela and hope she's soon feeling better?
Absolutely. Yeah, please could you note that? And thank you, Angela, if you're listening. And I think you are. You know, she's put a lot of work making sure each and every one of you who have turned up today have turned up. So yeah, thank you very much, Angela. And do get well soon.